Hi, so today we're gonna start a new chapter of Kaumarbhritya. The name of the chapter is Navajat Vidyan, that it's neonatology, right? So we will start what points we are going to cover in this chapter are Garbha Vriddhi, that is we learn in the first year in anatomy, that is Masanumasik Garbha Vriddhi, the terminologies and in the neonatology, Navajat Shishu Paricharya, etc. things we will see in this chapter. What are the definition, its management, pre-term, post-term and high risk neonate, etc. things are we are going to discuss in this chapter. So let's get started. Garbha Vriddhi and Vikas. First point. So what says Acharya Charak? Acharya Charak defines the Purusha or human being is a combination of what? Sharira, Indriya, Sattva, Atma, etc. things. The combination of these four things is called as a Purusha according to Charaka. Among all these, Sharir is the primary and visible body structure, right? Which is mainly composed of the Pancha Mahabhuta. We know that Prithvi, Apa, Teja, Vayu, Akash. These are the Pancha Mahabhutas. This Sharir is created in the form of a Garbha, that is embryo, in the side the after union of a Shukra and Shunita and Jiva, etc. souls, according to Charaka. So we have learned this shloka already. The shloka is goes like Shukra Shunita Jiva Sanyoge Khalu Kukshigate Garbha Sautnya Syat Charak Sharistan 4 by 5. The shloka has been mentioned. Charaka, what that said? Shukra Shunita Jiva Sanyoga, the combination of Shukra and Shunita and Jiva खलु कुक्षिगतो गर्भः संज्ञा when it goes in a kukshi, that's what the side of the after the union of shukra shunita and jiva, that is called as, or that is known as garbha, right? So Acharya Charak and Charak Kashyapa has described the growth of the garbha during gestational period, that each particular we know that the 3 months having one trimester. So accordingly that they have explained already, we have seen in seen the chapters regarding what the Mahata Garbhavakranti, Khuddaka Garbhavakranti, Garbha Nirman, etc. on the basis of the fundamentals of Panchamahabhut, etc. we have seen already. Just we will revise that. Mahata Garbhavakranti was, this says that the formation and development of the garbha on the basis of what their origin, like Matruja, Pitruja, Rasaja, Satma, Sattva, Atma, etc. things, right? The combination of all these, right, that has been told in a Mahata Garbhava Kranti Adhyaya, right? So Khuddaka Garbhava Kranti, what says that the formation and development of the garbha on the basis of what? Month-wise development of the fetus in a 9 months of the gestational, called as Masanumasik Garbha Vriddhi. I already says that Masanumasik Garbha Vriddhi. So how from first month we know that Pratham Masik Alalam Jait, etc. things. Shlokam in the first month, then the second, then third, how Masanumasik Garbha Vriddhi take place, etc. things has been explained in the Khuddaka Garbha Granthi Adhyaya, right? So third point is a Garbha Nirman on the basis of what? Panchamahabhut fundamentals. According to the Ayurveda, all the creatures on the basis on the earth are made up of what? We know that Sarvam Dravyam Panchabhautikam Asminarthe. All the dravyas in the universe are made up of a Panchamahabhut. So this is one another theory regarding how the Garbha Vriddhi takes place, right? So we will see the next point. So this is a chart has been given, that is according, they have given a comparison regarding how Panchamahabhutas has compare to which elements of the body, right? We have seen in the comparison in already second year Charaka Samhita. So if you are interested, you can buy the shloka. Otherwise I just take a explanation of this each Parthiv Bhava, Apya Bhava, Tejas Bhava, Vayavi and Nabhasa Bhava, etc. with comparison to the human body, right? So we will see one by one. So Prithvi or Bhumi Mahabhut. Prithvi Mahabhut is the main Mahabhut responsible for what? Visible shape. So we know that Prithvi Mahabhut is a hard weight in the body. So which things or which structure gives the body form in a correct form, or which thing give the structure to the body, that is skeleton. We know that so it is a hard and compared with the Prithvi Mahabhut. So visible shape and weight of the any substance or material is comes under the Prithvi Mahabhut. In addition, Prithvi Mahabhut is responsible for what? Formation of the organs and sense of fluctuations, heaviness and stability of the elements. All these things which is a hard presence of the hard thing in a body is, in easy words, the presence of the hard thing in a body is compared with the Prithvi Mahabhut. So Mamsa, Meda, Asti, Majja, and Kapha dosha mainly, more important, Kapha dosha, Purusha Mala in a human body, etc. things are comes under the Prithvi Mahabhut. So next is the Apa Mahabhut. Apa Mahabhut goes through which are the Jala contents in our body, whichever it is a saliva or etc. All the things comes under Jala Mahabhut. So Jala Mahabhut is the main Mahabhut responsible for what? Softness or moistness. What gives the moistness to the body? All the things comes under Jala Mahabhut or Apa Mahabhut, nutrients inside the substances, etc. Jala Mahabhut is responsible for the adherence of the two Parmanu, that is particles of any substance, and formation of the organ and sense of taste, etc. Because it is a weight in a nature, so combination of the two things which and making or responsible for the sense of a taste, etc. things comes under the Apa Mahabhut. So a Jala Mahabhut plays next is a Jala Mahabhut plays a key role in the formation of the Kapha dosh. Here also mentioned that Kapha dosha formation, and here also has been given Jala of a Kapha Mahadosha, sorry, Kapha dosha, right? Rasa, Rakta, etc. or Shukra Dhatu, Mutra, Swed, etc. things are formed under the Apa Mahabhut. Tej or Agni Mahabhut. Agni Mahabhut is the main Mahabhut. We know that for the digestion or compared with the Pitta dosha also has been compared with the Agni or Tejas Mahabhut. So Rakta also, because it is the Ashra Sambandha, Rakta also comes under the Teja Mahabhut, Mutra, Sweda, Mala, Teja Mahabhut, and first most importantly, Teja Mahabhut is the root of all kinds of digestion and transformation of inside the human body, right? So any kinds of digestive fire or digestion which is responsible or happens due to the Teja Mahabhut. Next is the Vayu Mahabhut. Vayu Mahabhut, we know that Vayu, what is the earth of it? It's a sparsha, that is so the organ of a touch, stimulation of a different biological reactions and tissue formation inside the body are all responsible due to the Vayu Mahabhut. Next is Akash Mahabhut. Akash Mahabhut is what? All the hollowness in the body, sorry, all the cavities present, coelomic bodies present, oral cavity, intestinal lumen, etc. All kinds of the lumen present in the body, all kinds of empty space present in the body is directly compared with the Akash Mahabhut, right? So this comparison has been given in a Prithvi, Aap, Tej, Vayu, Akash, Pancha Mahabhuti comparison has been given, which is a compared with the bodily tissues, right? Next we will see next point. So the next point is a Khuddika Garbha Kranti, Masanumasik Garbha Vriddhi in a fetus, right? So it is not necessary to learn all the acharyas. We just because they have given nearly similar explanation, so we will just go through what they have given different or nearly that same explanation has been given. We are seeing only of a Charaka, and next 2-3 acharyas we will just compare what they have given or not, or extra what they have given, right? So in Charaka, what Charaka says that Prathama Mase Kalalam Jayate, right? So these are important shloka for if the Masanumasik Garbha Vriddhi question arise in exam, we will see or start with these shlokas, small shlokas, right? So Prathama Mase Kalalam Jayate, first month there is a mucoid structure, no shape viable and discrimination in the product of conception, that is Kalala, what they say like a structure. Sushruta given also same, Pratham Mase Kalalam, explanation is the same. So Vagbhata also Abhyaktam Prathame Mase Saptahat Kalalam Bhavet. Vagbhata also says that it is like a Kalala, what Kashyapa says. Kashyap also has given what Kashyapa says, that sperm and ovum unite together and start the form of a different structure of a embryo, like a hard structure develop, and paternal genetic materials and soft organs from the maternal genetic material. So explanation, Kashyap has given little different explanation, but the meaning is or comparing with these three has little explanation has been different. Sorry, the explanation has been given, it's little different, but the meaning is exact, right? So we will go through only Charaka explanation, right? So Dvitiya, what says Dvitiya Ghanaha Sampadyate Pindaha Pesham Arbudam Bhavati. Next is in a second month of pregnancy, the babies look like a Arbuda. Arbuda is what? Arbuda during the second month, product of the conception takes shape either solid, pebble like a shape, flat cellular structure shape, or like irregular solid mass, right? That is Arbuda, irregular solid mass, that is Arbuda. And second month is look like Arbuda. We will see. In the third month, Tritiya Mase was said that Tritiya Sarvendriyani Sarvanga Vayavasya Yoga Padena Abhi Nivartante. What that means that formation of the all sense organs and different systemic organs. In the third month, all the systemic organs has been developed and a sense also develops. Shushut said same explanation. Sarvanga, Pratyanga, etc. will be developed. Vagbhat also given same Masya Tritiya Gatra Panchakam, that all organ are formed and embryo takes shape like a human contour. And Kashyapa has given all the body structure, all the body system and different parts are formed in the third month. So explanation is the same. In the fourth month, what? In fourth month, Chaturte Sthiratvam Apatyate Garbha Sarvangavayascha Pravyakto Bhavati. Fetus gets stable and chances of abortion reduced in 4 months. So in 4 months, chances of abortion has been reduced. In the fifth month, Panchame Garbhasya Manshu Shonitam Upachayo Adhikam Bhavati, that is increase in a muscle mass. So here what, nearly the development of the baby has been formed or nearly developed baby till 4 months. In the remaining 4 months or 5 months, the baby get more 3 to 4 months, the baby get more stronger and stronger. All the muscle mass will be developed in the fifth month. We see that's what, but Mansashonitam Upachayate Adhikam Bhavati. So the baby is developed in a 4 month. So the chances of the abortions are reduced in a 4 month. So here what happens that the uh, growth of the baby is vigorous, that baby will get strengthened in the fifth month. So increase in the muscle and body tissues of the fetus, weight gain in the fetus. What I said that weight gain in the fetus, the weight of the baby get increased. So next in 6 months was just said that the what says shashte garbhasya bala varna upachayo adhikam bhavati. What adhikam bhavati? That is improvement of strength and complexion. Here babies are already developed very well. So right, so till the fifth month all the body and baby has completely formed well. So in the remaining months it get only improvement in his body and strength. So 6 months we have seen. So in a saptam mass, what happens in a seventh month? So here in a 7 month saptame sarve bhavo apyayate garbha, there is improvement in all factors of the fetus like a muscle, blood, organ and development. We have to just remember that till the fourth month the baby's different organs has been developed at a particular period of a time, but after that the baby has nearly formed properly, and the only what has been formed properly is get improve and improve by the time, right? So in 7 month also we says that muscle, blood, organ etc will be developed or improvement happen in that. And in ashtamamas, ashtami astir bhavati oja, here is important, in which month the oja will be imbalanced in oja, in which month? That is the 8th month. So there is an increase in the transfer of the material, antibodies and immunological across placenta of the fetus, which gives strength, health and longevity to the fetus. So here in 8 months the oja has been started to form. And if some we see that like a clinical example we will take, if the baby get delivered in 8 months, we have seen that the babies are not as much stronger as the baby which is delivered in a 9 month. Why? Because of the oja is not formed properly in his body and it gets delivered prematurely. That's why the complications will get happens in ICU. So we see that, and we know that, right? So in the 8th month the oja is asthiri bhavati oja in ashtam month, right? So we'll see in the next month. So in a 9 month what says that after the completion of the 8 months, even a single day after the completion of the 8 months, it's said to be time for birth. So not everyone's for a maturation of the baby takes 9 months. Some will deliver the baby before some days, but has given that after the formation of 8 months, before 8 months it is not good for delivering a baby, but after 8 months we can take as or deliver a female delivers a healthy baby, right? So in what 9 months the baby has been delivered completely, right? So what happened in 10 months, they have given, Sushruta has been given explanation regarding fetus continue to grow slowly till birth. Maximum 12 months after that there is a development of the anomalies in the fetus. So what Sushruta says that maximum 12 months is the period for a delivery has been given. right? But after that there is a development of the anomalies, means fetus has been started to degenerate or degradation has been started his body. So Shushruta has given Charaka, Vagbhat and Kashyap has given only 9 months of period for the delivering a baby, but Sushruta has given till 12 months there is a possibility of the delivering of a baby. There is no any abnormalities according to Sushruta. So this is a Masanumasik Garbha Vriddhi. We will see some applied and clinical aspects here as given here. So in for the first month, that is a Kalala. What Kalala means equivalent to the exponential cell growth without cell differentiation, only a single cell. Ghana is that second month, what it is a Ghana or a solid like a structure. It is a dense structure started with the cell differentiation and formation of the yolk sac, right? So in the third month, what Panchapindika and Sarvanga Patyanga Sukshma. What with comparing what limb birds of the both upper and lower limb. So here birds like a propuce has been started to develop to the baby or a cell from upper side and lower side. That is a two limbs of upper and lower, right? So what is Sarvanga Patyanga here? Development of the organ and organ systems from the differentiated cell mass. So that different cell has been divided upper and lower limbs. After that organ and organ system will be developed after that in a 4th month. So in a 5th month, mana abhivyakti and mansa shonita vriddhi. Mana, what compare with what activation of the blood, right, in embryo, and accelerated blood formation in embryo along with what increased fetal movements in the response. But 5th month we know in the 5th month of the 5 months of baby, it will show some movements or stimulations in right? So in 6 month, what buddhi and balavaran etc will develop compared to the brain cortical tissue has developed at the month of the 6th month, and maturation of the immunoglobulin, maturation of the dermal skin with what increased immunoglobulin production. This happened in 6 month. In a 7 month, what Sarvanga Patyanga will be developed, and Sarvanga Patyanga will be developed with Pravaktatra, and Garbha Sampurnata has done in 7 month. So anatomical and physiological maturation of the organs will achieve the level of viability by the fetus in a 7 month. So in 8th month of pregnancy is asthira, which we have seen already. There is a state of viability is suspicious that fetus may not survive after the birth, right? So some complication will be developed if the baby has parturited or it get delivered in 8 month, in between the 8 month after the 7 month, right? There is a Vaidya should, so what says Vaidya should prevent akal prasava in this month. So improper delivery should be avoided at the 7 months, in between 8 months, right? So after 8 months, even 1 day could be better time for delivering a baby. So in 9 months, fetus is completely viable, and there is a physiological appropriate time for the delivery, right? So we have seen here what is a Masanumasik Garbha Vriddhi. So next we will see how embryological development has been taken, or how in a first month what happens, what in 8 weeks or each particularly trimester, we will see in the next video. Okay, thank you.